all about hormonal changes in pregnancy. Most of the people have some misconceptions regarding um, uh, they always assume that hormones are bad because somehow people always associated all the things that go wrong in our body with abnormal hormones. But what we need to remember are hormones are small molecules which are the means of communication between different organ systems in our body. So, if there is an imbalance, then we have a disease. The disease is causing abnormal hormone balances, so we are sick. But it does not mean that we are sick because of hormones. If the hormones work perfectly well, there will be no sickness. So when there is if suppose we need this much amount of hormone and our body is producing only this much, then we will have a deficiency. If it's producing too much, we will have a excess hormone. So most of the people don't understand that, and they think that hormones cause diseases. And pregnancy is one situation where in a woman's body the baby is growing and the mother provides all the nutritional supplements to the baby. Mother gives the oxygen. Mother gives an environment in which that baby can grow to its full potential. Mother protects that baby till it is ready to come out and live on its own. And for that, the mother's body needs to make a lot of changes to accommodate this growing baby. So those changes occur because there is a unit called the placenta through which all these nutrients go across to the baby. All the waste material, carbon dioxide, comes out from the baby, and the hormones that are produced in the placenta change the maternal mother's entire organ systems so that she is ready to nurture that baby for 9 months. One of the first hormones that comes, and the unique hormone of pregnancy, is called HCG. And in fact, HCG is produced in the human body only when there is a baby that is growing, and that trophoblastic tissue sends in hormones to the mother, that the mother begins to accept that baby. And we use that hormone medically also in various different ways. And the urine pregnancy test that is done almost universally by everyone when they need to know whether they're pregnant or not is based on picking up this hormone. So the hormones circulate in our body, then is passed out in the urine, and in the urine, if there is HCG, you know that the pregnancy test is positive. The hormone rises abruptly, stays till the third month of pregnancy, and slowly comes down, because by then the other hormones that are there in the body also take over. And this hormone is the one that is an indication of the placental health and the baby growth. So once HCG is there, once placenta is there, once estrogen and progesterone are there, these hormones are necessary for the uterus to grow, for the uterus not to contract and push out the baby, and let the baby stay and grow inside till the time 9 months is completed. The baby says, I'm ready to come out and live in this world independently. That is, till then, the progesterone hormone is extremely high in the mother and it maintains the pregnancy. So, that is what pro means for. Gest means gestation. So progesterone name is derived because this is the hormone that is necessary for the pregnancy to continue for 9 months. Along with that, Estrogen is one hormone that is necessary to build up. Normally, uterus is only this much size. But when there is a baby, the baby will grow this big. So the uterus should grow that big to accommodate this baby. So that growth of the uterine muscle, the increased blood flow that comes into it, the increase in the maternal breast size, so that once the baby comes out, it can grow, it will get adequate food. All these hormones are coming from estrogen. So the hormone changes in the women during pregnancy make sure that there is more blood volume, there is better absorption of nutrients and food from her GIT, the nutrients go across the placenta, her cardiac function increases, her respiratory rate changes, her kidneys function not only for herself, they also function for her baby, so that the waste material of the baby grows. And there is an increased anabolic pathways. That means normally when we take in food, some amount of food is used to grow, but a large amount of things are destroyed and thrown outside also. Pregnancy is one unique condition where you have very less destruction and you have growth of everything. The mother's blood volume increases, her circulation into the baby increases, the baby grows in size, the uterus gets a good blood supply, the baby has its own synthesis of RBC, its own protein synthesis. So all these are manipulated by the hormones that are there uniquely in pregnancy. And these hormones, normally what happens when we eat, our blood sugar increases. When after 6 to 8 hours of eating, slowly the blood sugar levels fall. Usually we eat again after an 8 hours, and then again the blood sugar level increases. But what happens is, after our body uses our metabolism, the that blood sugar needs to be going into the baby for its growth. So if we have so much fluctuations in the blood sugar, then the baby at times gets lots of sugar. The rest of the time it has absolutely no food, because baby is continuously using that energy and it will become hypoglycemic. To prevent that from happening, all the pregnancy hormones like human placental lactogen, estrogen, progesterone, the steroids that are produced, all of them will counteract the insulin hormone, which is bringing the maternal blood sugar down. And so when we eat food, if the insulin does not work adequately, the maternal blood sugars can shoot up very much. So there will be a compensatory increase in the mother's insulin also. So this balance of increase in the hormones that are decreasing the effectivity of insulin and the increase in insulin both together ensures that the mother's blood sugar levels do not change too much, and baby gets adequate amount of sugar all through its time in the uterus, whether the mother is eating food or not eating for the next 6 to 8 hours. When there is an imbalance in this ability to cope up and increase the insulin levels, mother's blood sugars increase so much and it becomes a gestational diabetic. And we are very worried, because almost 1 in 10 women whom we are seeing now, especially high risk women, women who are having polycystic ovarian issues, women who are obese, women who are having a family history of diabetes, they are developing gestational diabetes. That means the diabetes is detected for the first time in pregnancy. And if the blood sugars are not under control, that high blood sugar is going to go across the placenta to the baby, make the baby also have increased insulin. The babies grow very big. They're called macrosomic babies. You would have heard occasionally that this lady had given birth to a 4.5 kg, 5.5 kg baby. So these children are born obese, and if that continues into childhood and adolescent obesity, this will remain as an adulthood obesity, and they are at a much 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 higher risk of having development of diabetes very early in their lifetime. So if a woman has diabetes in pregnancy, it is very important that her diet is controlled. She eats small, frequent meals. She does a regular exercise program. She avoids food which has a high glycemic index, monitors her blood sugar at home regularly, and uh, um, if necessary, takes insulin to maintain the blood sugar. One of the other problems that we face frequently is that we are seeing an increased number of people having thyroid problems who are becoming pregnant. So, thyroid is a hormone that needs to keep our metabolism going. And if we don't have enough thyroid hormone in our body, the metabolism slows down. And then what happens is all things become extremely sluggish. Since pregnancy is a condition where there is a high demand mm, of energy and requirements, if we don't increase the thyroid supplementation, this same hypothyroid metabolism is also going to affect the baby inside, because for the first 3 months the baby is dependent on the mother's thyroid hormones. If the mother itself does not have adequate thyroid hormone, she is not going to be able to give it to her baby. So her baby's development will be affected. Number two, the in our brains, the number of brain cells we have, the uniqueness of the brain cell is one cell has a lot of network. So it takes input from 10,000 other neurons, analyzes them, and gives output to 10,000 more neurons. So this entire brain networking is what gives us our intelligence, our IQ, and things like that. And these will happen within the first 3 months of pregnancy. So if a woman has hypothyroidism, she needs to increase her dose of thyroid early in pregnancy so that her baby's neuronal development occurs. So, hormone changes. Naina was asking me, one of the questions that came across is, when do hormone changes happen in pregnancy? Hormone changes happen in pregnancy as soon as the pregnancy occurs, because pregnancy is a unique state where the mother should accommodate a growing baby. So, as I was telling you, the first change that will occur with the pregnancy, even before the mother knows she's pregnant, is having a rising beta HCG change. And when do pregnancy emotions start? That's a very, very, very variable thing. It depends upon originally how well prepared you are for pregnancy. Some amount of tiredness, inability to eat, change in our dietary patterns occurs within 1.5 months of pregnancy. The first 3 months, because the mother is adjusting to these various hormonal changes that are occurring pregnancy, mood swings and all are very common. From the third month to the seventh month is a comfortable period, because you can feel the baby movements inside and the baby is also well adjusted. But after the seventh month, again, because the nutritional demands of the baby are so high, that and the physical discomfort of carrying the baby is there, some amount of baby movements make the mothers uncomfortable. They have lack of sleep, inability to maintain deep sleep. not finding a comfortable position. So all these also have an impact on your emotional state. Not just hormones, it is the physical changes that are occurring in the body, the nutritional demands that are there in the body. All these also make a lot of changes regarding emotions. So women and some of the hormone changes in the body, what they do is they increase the water retention. So that is the reason rings become tight, there are puffiness of the eyes, swelling of the feet, and most of the time this is absolutely normal. Only in 10% will there be a high blood pressure associated with it. Do pregnancy hormones make you cry? If you're emotionally liable even before. See, there are women who have a lot of premenstrual tension. That means they have a lot of mood fluctuations that occur before the periods. Remember that in a, um, a woman who is having regular menstrual cycles, what are the hormonal fluctuations that are occurring in our body are the same hormones, the same that are occurring even in pregnancy. So, if women are more prone to mood changes before having periods, they have a lot of headache, they have a lot of puffiness, they have a lot of water retention, they have a lot of pimples coming up on their face, breast heaviness, irritability, and anger, emotional liability, feeling of weeping, and episodes like that occurring in their menstrual cycles. These are the women who are going to have these emotional changes even in pregnancy. Normal hormone fluctuations are like this, pregnancy hormones are fluctuating around here. So the same status is going to be there. And especially if there is history of family history of depression, this is going to really aggravate in pregnancy. And not only do these hormone changes continue in pregnancy, even after delivery, women who are prone to these emotional episodes, the around 5 to 6 in 100, 5 to 6% do have postpartum depression. That occurs when you're not very sure about the ability to be able to look after such a fragile baby in your hands. You're not sure because babies don't tell us anything. They cry when they want to be held, they cry when they're hungry, they cry when they're passing urine, they cry when they pass motion, they cry when they're not able to sleep. So everything, the babies cry a lot. So if you're not able to cope up with that, and the sleep cycles gets disrupted, nowadays many of these babies, what happens is all through the day they will sleep and at night they're awake, and the more, as long as you're carrying your baby, the baby is fine, and when you put your baby down, immediately they will start crying. So the women and the entire family, what happens is within the first 10 to 15 days of birth and life, you realize that you can hardly ever sleep, because during the day you have relatives coming to wish you and see your baby and how they're all excited, so you can't sleep then. And in the night the baby keeps you up all through. So almost it takes a month for babies to play, take adequate feed by 12 o'clock, and let you sleep uninterrupted for 4 hours. So this lack of sleep and also will lead to a lot of postpartum depression. So the important thing in all these is remember that every phase, almost at some point of time, women would have gone through it. So it's a transitory phase. So pregnancy is a unique time where you need to look after your health, where you need to eat well, where you need to have an emotional balance, where you need to take plenty of of fluids. If you have hypothyroidism, make sure your thyroid supplementation, your test is done and your supplementation is given appropriately. Don't eat big meals. Don't eat easy carbs like soft drinks or a lot of sweets. And in as Indians, we are more prone to diabetes, so it is advisable that you don't take lots of white rice. Avoid sugars, avoid sweets, so these make your blood sugars maintain well. Get your testing done for diabetes in pregnancy. If you have diabetes, don't worry. Make sure that you have a diet, you monitor your blood sugars at home, keep the blood sugar. Your fasting blood sugar should be somewhere around 85 to 90. The post lunch or post meal 2 hours blood sugars should be around 120. So as long as you maintain that, you will be healthy and your baby will be healthy. So to conclude, our takeaway messages are that uh, changes in pregnancy occur, and the hormones are the driving force for that change. Nature has a way of making sure that mothers are healthy and babies are born healthy. It is that with our modern lifestyle, with lack of exercise, with eating a lot of junk food, eating irregularly, lots of oily food, that we are making more and more abnormal changes in our metabolism, which is causing us so many health problems. In pregnancy, at different points of time, your body will be undergoing different changes. First 3 months, you hardly feel like eating anything. So try lots of alternative fruits. Make sure that you take nuts. Make sure that you take plenty of water. Make sure that you include lots of fruits and vegetables in your diet. Carbs should be less. If you take egg, take one every day. If you're taking non-veg, eat it limited, well cooked, less spicy, easy digestible food. Small frequent meals. Have regular checkups. Get your blood tested for thyroid problems. Get your blood tested for diabetes in pregnancy, because we believe that uh, uh, all the diabetics, they are because of our lifestyle, and because of our abnormal dietary intakes and our food habits, eating very late, skipping breakfast. So if you're healthy, then your baby will also be healthy and you will have a smooth and uneventful pregnancy. Wishing you all, whoever has joined us, all the best, and do take care of your health. Thank you.